That the United States and Mexico have agreed to restrict non-essential travel across our shared border. Both our countries know the importance of working together to limit the spread of the virus and ensure that commerce that supports our economy continues to keep flowing. Here too, the United States is glad to have a friend who's working side by side us in the fight. Afghanistan, holding the Iranian regime accountable for its malign activity and our counterterrorism. Yesterday, the State Department issued a Level 4 global travel advisory. This means that all international travel from U.S. citizens should be avoided. In countries where commercial departure options remain available, U.S. citizens who reside in the United States should arrange for immediate return to the United States unless they're prepared to remain abroad for an extended time. If you choose to travel internationally, your travel plans may well be severely disrupted. Department team here in Washington and around the world that are working overtime to help us push back again. Just urge everyone, as they're seeing information that at one time suggested somehow this virus emanated from the United States Army, this information about lockdowns that are taking place. Every American, indeed people all around the world, should ensure that where they turn to for information is a reliable source and not a bad actor trying to create and flow information that they know is wrong. It will be reviewed after 30 days, and they exclude traffic and movement across the border for work.
Let me be clear that neither of these agreements with Canada or Mexico applies to lawful trade or commerce. Essential commercial activities will not be impacted. We will continue to maintain a strong and secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services, and individuals engaged in lawful cross-border trade. Let me first address the progress as Secretary Pompeo and others. Furthermore, we're also working collaboratively with Canada and Mexico to take decisive joint action regarding individuals seeking entry between our ports of entry. The CDC order directs the department to suspend the introduction of all individuals seeking to enter the U.S. without proper travel documentation. That's for both the northern and southern border. Will not be impacted. We will continue to maintain a strong and secure. The CDC director has determined that the introduction and spread of the coronavirus in the department's border patrol stations and detention facilities presents a serious danger to migrants, our frontline agents and officers, and the American people. So it's important to note that the department currently apprehends foreign nationals from over 120 different countries around the world, the vast majority of those having coronavirus cases. Many of these individuals arrive with little or no identity, travel, or medical documentation, making public health risk determinations all but impossible.
In China, we began screening travelers from Wuhan. Then over time, as the outbreak of... We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. Customs and Border Protection Station. It does not apply to U.S. In such circumstances, the kind of social distancing measures the CDC and the President have recommended are simply not possible. On top of that, any resources that we are using to reduce the risk of infection among CBP agents, healthcare workers, and migrants in these facilities are drawing on an American healthcare system that is already fighting the coronavirus pandemic.